Welcome back to the Vital Signpost. I think everyone listening knows that working with cardiac patients means dealing with some pretty intense stuff.
Definitely.
So today we're doing a deep dive into some real bread and butter cardiology.
Okay, sounds good.
We're talking coronary artery disease, or CAD for short, chronic stable angina, and acute coronary syndrome, ACS.
All right, so covering the whole spectrum there.
Exactly. And we've got some really interesting sources to pull from. We've got a journey through grief to give us that patient perspective.
Oh, good. Always important.
And for the clinical side, we'll be looking at coronary artery disease, angina, and acute coronary syndrome overview.
Perfect. Solid foundation. So where do we want to start?
Well, I think it makes sense to begin at, the root of the problem, atherosclerosis. That word alone already sounds pretty scary.
It really does. And it actually is quite descriptive if you think about it.
Oh,
How so?
well, the word atherosclerosis comes from the Greek word there, which means, get this, gruel or fatty mush.
Ew. Okay, I see where this is going. And then you combine that with scleros, which means hard.
So basically hardening of that gunk inside the arteries.
Yeah.
Pretty vivid, right?
Exactly. Paints a very accurate picture. And that buildup, as you know, doesn't happen overnight.
So walk us through how this atherosclerosis progresses. What are the stages?
Okay, so it starts with what we call a fatty streak. That's where lipids start building up in the walls of the arteries.
Like a little stain in the pipe, almost.
Yeah, that's a good way to think about it. And over time, that streak turns into a fibrous plaque. It's basically the body trying to contain the damage, but it ends up narrowing the artery.
And that's where the real trouble starts, right? With the blood flow restriction.
Right. Now, this can actually go on for quite a while without the patient even noticing.
But it sounds like a ticking time bomb.
It kind of is. The real danger comes with the third stage, the complicated lesion. That's when the plaque becomes unstable. It could rupture,
Oh, no.
and that triggers a whole cascade of events. You can end up with a heart attack, but the body does try to compensate, doesn't it?
I was just going to ask about that. The text mentioned collateral circulation. What is that exactly?
Well, collateral circulation is pretty amazing, actually. It's where the body basically tries to build its own bypass surgery.
Wow.
So new blood vessels develop trying to go around those blockages, but it's not a perfect system. It takes time.
And it might not be enough to make up for those really serious blockages.
Exactly. And I think that's a crucial point for nurses. We have to educate our patients.
Let them know that their body is fighting, but they can't just rely on that.
Right. We need to talk about prevention. We need to catch things early.
Absolutely. It's all about addressing the root cause, not just putting on a Band-Aid when the symptoms finally hit.
Could not agree more.
So let's talk about what puts people at risk in the first place. I mean, we all know the usual suspects.
Sure. Smoking, bad diet, not being active enough. That's the stuff everyone hears about.
But the research shows there's more to it than that. Some less obvious factors, too.
Oh, absolutely. Did you know that type A personalities, those really driven, competitive types?
Oh, yeah. Always in a hurry.
Well, they might actually have a higher risk of developing atherosclerosis.
So our personality can impact our heart health. That's pretty wild.
It is. The thinking is that chronic stress plays a big role in that.
That makes sense.
Yeah.
What else do we need to watch out for? What else gets overlooked?
Well, substance use is another big one. Cocaine and meth especially.
Oh, right.
They can cause some really intense coronary artery spasms.
Which I guess makes sense considering how those drugs work.
Yeah, huge strain on the whole cardiovascular system.
Yeah.
And then there's the whole debate about homocysteine.
Homocysteine.
Yeah, it's an amino acid, and high levels of it are linked to an increased risk of atherosclerosis. Now, there's some back and forth about whether folic acid can help with that.
Interesting.
Does it actually lower homocysteine enough to make a difference in terms of heart disease?
So it's not just checking boxes on a form.
Yeah.
We have to dig deeper.
Absolutely, the whole picture. Lifestyle, stress, drugs, it all goes into the assessment.
And that's where those good communication skills come in. Open-ended questions. Really listening to what the patient is telling us.
You got it. Connect those dots. It's all about the details.
Okay, so we've talked about angina, basically that warning signal from the heart, right?
Yeah, saying, hey, I'm not getting enough oxygen here.
But it's not always just a warning, is it? Sometimes it turns into a full-blown emergency. And that's where we get into acute coronary syndrome.
Right. Things can escalate pretty quickly.
So what exactly causes that shift from stable angina to acute coronary syndrome? What's happening in the heart?
Well, with acute coronary syndrome, you're looking at a sudden, really significant drop in blood flow to the heart muscle. And usually what happens is a plaque ruptures inside a coronary artery.
Oh, so it's not just narrowing anymore, it's a rupture.
Yeah, and that rupture triggers a clot. And that clot can partially or even completely block the artery.
So, like, we've gone from a traffic jam to a complete road closure.
Perfect analogy. And remember, acute coronary syndrome, it's an umbrella term. It covers a range of things.
From unstable angina to an actual heart attack.
Exactly. Myocardial infarction. And within that, we've got two main types.
NSTEMI and STEMI.
You got it. So NSTEMI, that's non-ST segment elevation myocardial infarction.
Okay, that one sounds a little less scary than STEMI, I guess.
Well, in STEMI, the blockage is definitely significant, but it might not be a complete blockage. And you don't see that classic ST segment elevation on an EKG.
So it's still a heart attack, but maybe not as severe as a STEMI.
Generally speaking, yeah. But both of them, and STEMI, they're serious. They need immediate attention.
No messing around with those.
No. Now, STEMI, ST segment elevation myocardial infarction, that one means a major coronary artery is completely blocked.
And that's where that saying time is muscle comes in.
Absolutely. Every minute matters. We have to restore that blood flow fast.
Minimize the damage. So how do we know for sure if someone is having a heart attack? The text mentioned cardiac biomarkers.
Oh, yeah, cardiac biomarkers. Those are proteins that get released into the blood when heart muscle cells are damaged.
And I'm guessing there are specific ones we look for?
Troponin. That's the gold standard for detecting a heart attack. Very specific and sensitive.
So if we see elevated troponin, that's a pretty clear sign.
Pretty much. And we don't just look at one level. We take several measurements over time, see how things are trending.
So that gives us a better idea of how much damage there is and helps us see if the treatment is working.
Exactly. So rapid assessment, rapid diagnosis, super important here.
And once we know what we're dealing with, then we can get into treatment.
Right. And there are a couple of main approaches, medications and procedures.
Like PCI, for example.
Yep. So for medications, you've got your antiplatelet drugs, nitrates, beta blockers, ACE inhibitors, and statins.
Wow, that's a lot of different meds. So they each have a specific job to do, right?
Oh, yeah. Each one targets a different aspect of the problem.
Break it down for us. How do they all work together?
So antiplatelet drugs, things like aspirin, clopidogrel, they stop those platelets from sticking together, which helps prevent clots.
Okay, keeps the blood flowing.
Right. Then you've got your nitrates, like nitroglycerin. They widen the arteries so more blood can get to the heart muscle. Really important to watch out for hypotension with those, though.
Of course. Always got to keep those side effects in mind. What about beta blockers?
Beta blockers work by slowing down the heart rate, take some of the workload off the heart,
Giving a bit of a break.
Yeah. ACE inhibitors, those relax the blood vessels, lower the blood pressure, again, easing the burden on the heart. And finally, statins. They work on the cholesterol.
So medications do a lot to stabilize things,
Mm.
but sometimes you need to get a little more invasive.
You're talking about PCI.
Yeah, when is that usually done?
So PCI, percutaneous coronary intervention, it's basically a way to open up those blocked arteries.
Sounds pretty intense.
It's actually minimally invasive. So they thread a catheter with a little balloon on the end into the artery, inflate the balloon, pushes the plaque out of the way.
Ah, so it opens up the passage.
Yep. And then they usually put in a stent, which is like a little mesh tube, keeps the artery from closing back up.
With a little scaffold.
Yeah, exactly. And PCI, it's often the go-to for STEMI.
Makes sense. You want to restore that blood flow ASAP.
You got it. It can also be used for NSTEMI and unstable angina, depending on the situation.
And then there's CABG. Is that like a last resort kind of thing?
CABG, that's coronary artery bypass grafting. It is a more invasive surgery.
So when is it necessary?
Well, they basically create a detour around the blocked arteries.
So the blood has a new path to follow.
Exactly. Usually they use blood vessels from the patient's leg or chest.
Okay, so rerouting the traffic. When would you choose that over PCI?
Well, CABG is usually for people with more complex coronary artery disease. Maybe PCI isn't an option for them. Or their angina just doesn't respond to other treatments.
Got it. Now there's one more thing I want to talk about. Sudden cardiac death.
Oh, yeah. That one's a tough one.
Where does that fit into all of this?
So sudden cardiac death, it's often caused by ventricular fibrillation. Basically, the heart rhythm goes haywire and the heart can't pump blood effectively.
And the text mentioned that it can happen even in people who don't have any history of heart problems, right?
Yeah, that's the scary part. It's often linked to underlying heart disease, but not always. Sometimes it happens to people who seem perfectly healthy.
Like young athletes.
Exactly. And in those cases, it might be because of some inherited heart condition or a structural abnormality.
Really makes you think about how unpredictable heart health can be.
Yeah.
So what can we do about it? How do you prevent something like that?
Well, early detection is huge. If there's any underlying heart condition, we need to catch it and manage it. Regular checkups are key, EKGs, echocardiograms. And for high-risk patients, there's the implantable cardioverter-defibrillator.
Oh yeah, the ICD.
That's the one. It constantly monitors the heart rhythm. And if it detects a dangerous arrhythmia, it delivers a shock to get the heart back on track.
Pretty amazing technology.
It really is.
Wow. We've covered a lot of ground here, from atherosclerosis all the way to sudden cardiac death.
It's a complex topic.
But it really highlights how important nurses are in all of this, from assessment to treatment to patient education.
We're on the front lines, making a real difference in these patients' lives.
Absolutely. But before we wrap things up, we need to talk about the human side of all this, because it's not just about the science.
Oh, you're absolutely right. We can't forget that.
These are real people going through something life-changing.
Yeah.
And that emotional, psychological impact is huge. So let's explore that next. We've really dug into the science behind coronary artery disease, how it develops, the different types of angina, those acute coronary syndromes, even sudden cardiac death.
It's a lot to take in.
It is, but I think for nurses especially, we can't just focus on the clinical side, right?
Oh, absolutely.
We're dealing with people who are facing a really serious diagnosis, something that changes their whole life.
Right. We can't forget the human side of things.
Exactly. It's not just about EKGs and lab results. There's a person behind all of that, someone who's dealing with so many emotions, probably fear, anxiety, maybe even anger.
You hit the nail on the head. It's a lot to process. That diagnosis of heart disease can be a real shock.
Like the rug's been pulled out from under them.
Yeah, exactly. And then there's all the unknowns. What's going to happen? What about treatment? How am I going to manage my life now? It's a lot to cope with.
And we saw that in A Journey Through Grief, right? The patient's perspective really highlighted that. They talked about a sense of grief and loss.
And it makes sense. It's a loss of health, maybe a loss of independence. Maybe they have to change their whole lifestyle. Their plans for the future might be totally different now.
It's a huge adjustment. And that grief, it can show up in so many different ways. Some people might withdraw, others get angry.
It all depends on the person, how they cope. But as nurses, we're often the first ones there for them.
Right at the bedside, not just taking care of their physical needs, but being there emotionally too.
Supporting them through it all.
So how can we do that well? How can we help them navigate these really difficult emotions?
I think the most important thing is just to listen. Really listen.
Create that space where they feel safe opening up.
Exactly. No judgment. Just let them express whatever they're feeling, those fears, frustrations, worries.
Let them know it's okay to feel those things. We're not going to dismiss their fears or offer some cliche that doesn't really help.
We need to validate their experience, acknowledge how big of a deal this is for them.
And empathy goes a long way, doesn't it?
It really does. Even simple things, sit down with them, make eye contact, and just be present with them.
Shows you care, that you're there to support them.
And then there's patient education.
That's so important, isn't it?
Absolutely. Knowledge is power, right? When patients understand what's going on, what the treatment options are, what they can do to help themselves, it gives them a sense of control.
Like they can actually do something about it.
Exactly. And that's huge for their mental and emotional well-being.
So when we're educating them about coronary artery disease, what are the key points we need to get across?
Well, first of all, we need to explain what it is in a way they can understand. What's happening in their body? How did it get to this point? What are those risk factors?
Lay that foundation.
Yeah. And we also need to emphasize that coronary artery disease, it's serious, but it's manageable.
There are things they can do to improve their chances.
Exactly. We don't want to scare them, but we do want them to be active participants in their care.
So we talk about lifestyle changes. Diet, exercise, quitting smoking.
Those are the big ones. But it's not just about giving them a generic list of rules.
It has to be realistic, something they can actually stick with.
Exactly. We have to meet them where they're at, what works for their lifestyle, what are their preferences, set small goals that they can achieve.
And celebrate those wins along the way.
Absolutely. And of course, medication adherence is huge.
Right, we can't forget about that.
Those medications are so important in managing the disease and preventing things from getting worse.
But we need to make sure they understand those meds.
Exactly.
Yeah.
Why are they taking each one? How does it work? What are the potential side effects?
Answer all their questions. Be patient. Be thorough. We don't want them stopping a medication because they're confused or scared,
Right. That happens way too often. And we have to remember, a lot of these patients are on multiple meds.
which can be overwhelming for anyone.
It really can be, especially for older folks or those with cognitive issues. That's where those medication organizers come in handy. Pill boxes, things like that.
And maybe getting family or caregivers involved too.
Exactly. It takes a village sometimes.
And what about resources for patients and families? What can we point them to?
Well, the American Heart Association has tons of great stuff, information, support groups, educational programs.
It's good to know there are resources out there.
Absolutely. It can make a real difference.
It's that sense of community, knowing they're not alone in this.
Exactly. And connecting with others who understand what they're going through.
Well, we've covered so much in this deep dive, from the science to the treatments to the emotional side of things. It's been a really valuable discussion.
It really has.
And it all comes back to that crucial role nurses play.
Providing that holistic, compassionate care for our cardiac patients.
We're educators, we're advocates, and we're a source of support for these patients.
It's a privilege, honestly.
It is. And to everyone listening, keep learning. Keep these insights in mind as you care for your patients. Stay informed and stay well.